Interview with Clinical Manager Ms. Samkelisiwe Nkomonde-Akinrinade at JPS Africa Podcast Studio at Brooklyn, Pretoria. Thank you for taking part in this interview. The purpose of the discussion is to understand your experiences, perspectives, and recommendations regarding VMMC service delivery and training. Your responses will help improve program quality, client outcomes, and staff development. Ensuring competent, safe, and standardized VMMC services begins with effective assessment. As clinical manager, utilizing OSCEs to objectively evaluate and build clinical skills is critical to quality patient care. What is the overall role of clinical managers in using an OSCE?
Right. Thank you, Daniel. So the clinical manager acts as a program leader and quality assurance authority that is responsible for ensuring safe, high-quality VMMC services, overseeing training, assessment, and the competency certification of our clinicians, managing clinical development of our staff and the performance at our facilities, as well as ensuring compliance with national standards and guidelines.
Why is competency assessment important in VMMC services?
Competency assessments ensures that our providers have the necessary skills to perform VMMC procedures. It also reduces adverse events within the program and also maintain infection prevention protocols and standards, and also improves our HTS, which is HIV testing services at our facilities, and also improves client outcomes.
How does an OSCE differ from routine supervision?
All right, so routine supervision focuses on the general performance and administrative compliance, whereas an OSCE uses standardized stations as well as an objective scoring tool to evaluate clinical competence in a structured and measured way.
How can an OSCE improve surgical quality in VMMC services?
All right, so an OSCE helps us to identify training needs that further inform training and mentorship plans. Then it also improves the adherence to national standards and compliance, and also improves the quality of our outputs in our facilities.
What indicators can managers use to measure the impact of an OSCE?
So certain indicators like better improved performance by our clinical staff, a reduction in our adverse events rate, better performance in terms of infection prevention, protocol adherence, better client satisfaction, and better documentation quality within our documents within the VMMC space.
How can OSCE findings support quality improvement initiatives?
So OSCE findings can help us to identify training needs. They can also inform our mentorship plans, guide our supportive supervision, as well as to help facilities with their quality improvement initiatives.
The use of OSCEs within VMMC programs strengthens clinical competence, promotes standardization, and supports continuous quality improvement. As clinical managers, our responsibility is to ensure that every provider meets the required standards for safe and effective service delivery. Sama, thank you for your time today.
Thank you so much, Daniel.